Every voice needs to be heard, whether you're a parent, whether you're a person with CF, whether you're a healthcare provider or researcher, or just somebody who cares.
When you start thinking about how active of a community they are and access to information, there was not a great area for them to come together with their research partners. Years ago, they were able to come to the CF conferences, but now because of infectious reasons, they're no longer allowed to in order to keep themselves and others safe. That's what's so interesting about ResearchCon to me, is this is a true access to partner with the researchers and the caregivers who are trying to improve the lives of patients with cystic fibrosis.
There are people who are afraid to use their voice. And my mom raised me she said, you have a voice, you use it. Whether it is you're talking about yourself or you're talking for someone else, you use that voice and make sure that you're heard.
Having CF and having an interest in CF research has really been an important part of the way that I, have always kind of understood having CF and coped with all the uncertainty that comes with CF.
We are bringing that knowledge and sharing the updates and sharing that passion of wanting there to be a cure together and working toward that goal from both sides of the coins, from a healthcare profession as well as from a parent.
The research community across other diseases really could learn a lot from the CF community about just how much patients and family involvement is possible and how much that can really benefit the research as a whole.
There's love. There's just a lot of love in this, to putting events like this together.
ResearchCon gave me hope because it showed me where we're going. And it showed me that doors aren't closed. And if the doors are closed, then the windows are being opened. And if they're not being opened, then guess what? We're kicking them down.
If the last 3 years haven't taught us anything, it is grace and resiliency.
Yes.
We can still move forward.
Exactly. And know that you don't have to look like me for me to care about you and love you.
And you definitely don't have to meet in person, apparently.
My primary goal is having made a connection with a provider, with another patient, with another family. That is the success of ResearchCon to me. I still have families from around the country who email me after the first ResearchCon that I was a part of. And that's what is very unique about this, is you are able to build those type of relationships.
This will always be special to me because I met somebody like Lithuania. Without being part of it, I wouldn't have had that opportunity.
I hope that people leave here not feeling alone.